everyone, good day. My name is Franz Jasmine Swaner-Yap, your student nurse from Davao Doctors College. And today I am going to demonstrate the assessment of the cardiovascular system. So what is cardiovascular system? It is an organ system that permits blood to circulate and transport nutrients, oxygen, carbon dioxide, hormones, and blood cells to and from the cell of the body. It provides nourishment, fights diseases, stabilize temperature, and maintain homeostasis. So now review the client's medical record if available, but in my case, my patient did not have any previous medical record because this is her first visit. Then determine the scope of the assessment. This is done for you to be able to know the extent of the physical assessment. Then prepare the necessary equipment such as the ruler, sterile gloves, the pen light, the stethoscope, then of course the pillow. So now greet the client politely, introduce yourself, verify the client using the two identifiers such as his or her name and birthday, then ask how he or she would like to call during the assessment, then explain the procedure to the client on how he or she can participate during the assessment, and don't forget to perform hand washing to prevent the spread of the microorganisms. Hello ma'am, may I come in? So it is important to ask for the patient's consent before entering the room. Hello ma'am, good morning. So by the way, my name is Franz, your student nurse for today. So may I know your name? Okay, so when is your birthday? Okay, so is that okay that I'm going to check for your scan? Okay. So by the way, what would you like me to call you? Okay, so by the way, I'll tell you the procedure that I will be doing today is that I'm going to assess for your cardiovascular system or your heart. This is for us to know if you have any abnormalities that present in your heart. So I will be touching some parts of your body, and there are some movements that you should follow. Is that okay with you? Okay, so as you can see, I've closed the curtains for us to provide some privacy, and the information that I will be getting from you is secure and safely headed to the doctors. So do you have any clarifications or concerns? Okay, so let's get started. So now ensure the client's comfort and privacy, then drape the client's body throughout the assessment. Then inquire if the client has any existing or history of cardiac problems. Then ask of the lifestyle habits that are risk factors of cardiac problem. So I'll tell you, by the way, I have questions for you. Is that okay? Okay, so do you feel chest pain or are you uncomfortable? Okay. So do you have past health history such as the angina or myocardial infarction? Okay, so how about your lifestyle habits? Okay, so that means that you live for a healthy living. Okay, so thank you for that. So now let's proceed to the working phase. Assessment of neck vessels. So stand on the right side of the patient, then position the patient into a supine position with the bed elevated 30 to 45 degrees. Then instruct the patient or the client to turn the head slightly to the left side and show the tangential light source onto the neck, suprasternal notch, and area around the clavicles to observe for palpations and shadows. If the jugular distension is found, assess for the jugular venous pressure or the JVP by locating the highest visible point of distension of the internal jugular vein. Emphasize the distension with the tangential lighting. As deemed necessary, raise or lower the head of the bed until the highest visible point of the distension of the jugular vein was observed. So measure the vertical distance in centimeter above the sternal angle by extending a long rectangular object horizontally from this point and a centimeter ruler vertically from the sternal angle, making an exact right angle. Then do the same thing to the other side. Okay, so this assessment, ma'am, it means that it is normal because the veins is not visible, indicating that the right side of your heart is functioning normally. So now let's proceed to assessing the carotid arteries. So with the head of the bed slightly elevated, position the client's head toward the site being examined. So palpate the carotid arteries cautiously, avoiding too much pressure or massaging the area. Then turn the client's head slightly away from the side being examined. Then place the stethoscope over the carotid artery. So ask the client to hold his or her breath for a moment. Then auscultate the carotid artery, listening to the breath. And if the breath was heard, then gently palpate the artery to determine the presence of a trill. So okay, I'm going to check for your neck. So can you turn your head to the left side? Okay, to the right side. Okay. So turn your head to the left side. Then when you hold your breath for me. Hold your breath. Okay. The other side, then hold your breath. Okay, Althea, so in assessing your carotid arteries, it has a symmetric pulse volume, full pulsation and resting quality, and it remains the same when you breathe. So turn your head and when you change position. Sitting to supply and no sounds heard on auscultating your carotid arteries. Okay, so let's proceed to the assessment of the heart or the precordium. Inspect and palpation. So begin with the general inspection of the chest wall. So in movement, keep the right chest draped and gently lift the left side of the breast with your left hand. Or ask the client to do this for his or her assistants. Stand at the right side of the client with the head of the bed elevated at 35 degrees and look for any abnormal pulsations. Shine a tangential light across the chest wall over the cardiac apex to make this movement more visible. So stimulately inspect for the precordium for pulsations while palpating the aortic area, pulmonic area, and tricuspid area, and the apical area, and the following techniques. Palpate the hives and left using the palm and hold finger pads flat or obliquely against the chest. For thrills, press the ball of the hand firmly on the chest to check for a buzzing or vibratory sensation caused by the underlying turbulent flow. Then palpate the apical impulse using the palmar surface of 2 to 3 middle fingers. Then for finer assessment, palpate with one finger alone to confirm the characteristic of the apical impulse. Noting for the location, diameter, and amplitude. If unable to palpate the apical impulse of the patient supine, reposition the patient to roll partly onto the left lateral side. Ask the patient to exhale fully and stop breathing for a few seconds. And palpate again while patient maintains to be partly facing on her left side. Inspect and palpate the epigastric area at the base of the sternum for abdominal aortic pulsations. Okay, so Althea, I'm going to check for your chest wall. Okay, so can you inhale deeply for me? Then hold for it. Okay. Okay, Althea, so in assessing your pericardium, while inspecting and palpating your aortic, your pulmonic area and tricuspid area are no pulsations and no lift or highs. In the apical area, pulsations are visible and palpable in most and no lift or highs. In the epigastric area, it is normal because of the aortic pulsations. So now let's proceed to auscultation. So assess for the heart rate and rhythm by placing the stethoscope at the apex and listening closely to the rate and rhythm of the apical impulse. Count the heartbeat of a full minute. If irregular rhythm was detected, assess for the pulse rate deficit. Use the diaphragm of the stethoscope first, then the bell, then auscultate the heart for anatomic signs such as aortic, pulmonic, tricuspid, and apical, or mitral for heart sounds, extra heart sounds, and murmurs. Ask the client to breathe regularly while auscultating. Repeat the preceding steps while the patient is in left lateral position. Then, at sitting position, leaning forward and briefly, then stop breathing after exhalation. Okay, so today I'm going to assess for your heart rate and rhythm. Okay, so I'll tell you your systole is shorter and your diastole is long at normal heart rates. And of course, S3 is heard because you are an adult. Okay, so now let's proceed in assessing the peripheral vascular system at the upper extremities. So assess each arm size, symmetry, skin color, and temperature from fingertips to shoulder. Note for any presence of edema, lesions, changes in skin texture, and hair distribution. Inspect the peripheral veins in the arms for the presence and appearance of superficial veins, when limbs are dependent, and when limbs are elevated. Palpate for radial pulse, ulnar pulse, and brachial pulse, individually and bilaterally. Okay, so now let's check for any lesions, edema, skin texture, and hair distributions. So let's palpate for the brachial pulse, for the radial pulse, ulnar pulse, and the brachial pulse. So now let's perform the Elan's test. Then open your head. Okay. So again, with the fist. Okay, so let's check for a capillary refill. So can you do the refill? So the findings for this assessment is that your ulnar pulse is not detectable. In brachial, it has equal strength bilaterally. Your radial pulse is bilateral strong. Artery walls has resilient quality. So in capillary refill, it immediately back to its color. Then for the Elan's test, it blanches. So examining lower extremities. At supine position, assess each leg for size, symmetry, skin color, and hair distribution. Temperature from groin to toes. Then note for any presence of lesions, edema, changes in skin texture, and hair distributions. Inspect the peripheral veins in legs for the presence or appearance of superficial veins, when limbs are dependent and when limbs are elevated. Palpate for femoral pulse, popliteal pulse, dorsalis pedis, and posterior tibialis, individually and bilaterally. Then assess for the peripheral leg veins for signs of ulcerations, vasculosities, and thrombophlebitis. Inspect the calves for ulcerations, vasculosities, redness, and swelling over the vein sites. Palpate the calves for firmness or tensions of the muscles, the presence of edema over the dorsums of the foot, and the area localized warm. Push the calves from side to side to test for the tenderness. So firmly dorsiflex the client's foot while supporting the entire leg in extension or the human's test, or have the client stand or walk. Assess for the capillary refill of the both legs and repeat the preceding steps to the other leg. Okay, Althea, so I'm going to check for your legs. So I'm going to raise your legs. Okay, Althea, so can you stand and walk for me? Okay, this way. Okay, so walk. Okay. So the findings of this assessment, Althea, is that in your lower extremities, your skin is pink. The temperature is not excessively warm or cold. So no edema at all. And your skin texture is resilient and no moist. So in dependent position, there are presence of distension and nodular bulges at calves. And when the limbs elevated, your veins collapse. So your symmetric pulse volume is heard, and of course it has a full pulsations. It is symmetric in size limbs and not tender, and for your capillary refill, the color back to its normal. So it is all the findings, it is all normal. So now, inform the client that the assessment was done. So if necessary, assist the client to change for his clothes. Reposition the client in sitting on the chair. And the last thing is that summarize the information obtained during the working phase. Discuss the findings and the possible plans to resolve the problem or the health concern if present. Assess the client's understanding of the plan or for further teaching. Provide the client the opportunity to ask, and of course, thank the client for his or her cooperation. Document the finding of the client using the printed or electronic form. So hi again, Althea. So how do you feel right now? Okay, so by the way, the summary or the findings of the assessment a while ago, it is all good and normal, just like what I've said a while ago to you. And just keep your habits good and take care of yourself. So if you feel uncomfortable, just feel free to come back here so that we can run another assessment regarding to your heart. So do you have any clarifications or concerns? Okay, so that's good. So thank you for your time and cooperation. Then have a good day.